Nurse John here. I wanted to talk a bit today about air in the human body. Air belongs in the lungs, the GI tract, and the sinuses. Let's talk about crepitus and subcutaneous emphysema. Subcutaneous emphysema is the actual problem, air leaking into tissue where air does not belong. Crepitus is what we feel or hear when we assess it. When you touch the area, it may feel crackly, kind of like Rice Krispies under the skin. The area may look swollen. The skin can appear smooth and stretched. If you can hear or feel crackling during palpation or auscultation, that's air trapped in tissue. So let's look at lungs. Trauma to lung tissue is a common cause. Lung diseases which cause hyperinflation or compromised lung tissue, severe coughing, mechanical ventilation, especially in fragile lungs. Let's look at the GI tract. The GI tract can leak air when its integrity is compromised. Perforated ulcers, cancers, diverticulitis. Severe vomiting can cause esophageal rupture. Sinuses and upper airway. Air leaking from sinuses usually follows facial or head trauma, especially fractures. Air can track into tissues of the face, neck, and chest. What we don't do is watch YouTube, Google it, and go to bed. These are medical emergencies. Imaging is needed to identify the source of the air leak. In severe cases, trapped air can impair breathing, circulation, and organ function. Surgical interventions may be needed. Treatment in minor cases, marking and monitoring the borders of the crepitus, pain control, close respiratory monitoring, but the first intervention is always emergency evaluation. One interesting treatment is high-flow oxygen therapy. Since air is mostly nitrogen, over 75%, giving high-concentration oxygen creates a gradient that helps nitrogen move out of tissues and back to the lungs for elimination. So that's crepitus and subcutaneous emphysema. Not common, but very important to recognize. There are a whole host of other causes. These were just the highlights. Thanks for watching. Bye-bye.